Good morning, everybody. Thank you for joining us for our press briefing on the state's response to the pandemic. As always, we want to remind people that to be able to slow the spread of the virus, we need everybody to continue to practicing all the good rules and tools that we've given them to be able to slow down the spread. That means that, when you're sick, stay home, no matter why you're sick. You can always go and get tested to see if it's coronavirus, but if you're showing any symptoms, please stay home. We don't want to spread coronavirus or anything else at this time, so please make sure you're staying home. Keep that 6 foot of distance between you and other people when you're out in public. Wear a mask when you go to the store. Wash your hands often for 20 seconds at a time. That actually kills the virus. When you go out to the store, for example, shop once a week. Don't take the whole family, just go by yourself. And then, of course, Christmas shopping, same sort of thing. Really try and limit your trips. Obviously, we want you to get your Christmas shopping done, but try to, again, we want to make sure we got as few chances for the virus to spread as possible. And then, of course, if you avoid the 3 C's, that close contact, confined spaces, crowded places, that's how the virus spreads from person to person. You avoid the 3 C's, you'll help slow down the spread of the virus as well. And all this is about making sure we preserve our hospital capacity here in the state. Right now, we're at 30% of our hospital beds are available, 28% of our ICU beds are available, and 72% of our ventilators are available. And our hospitalizations, again, fell yesterday down to 677. So we're solidly in that yellow category right now. We want to continue that momentum. To do that, we need everybody to continue to slow down. And here especially, right as we enter into the holidays, and we're going to be talking about Hanukkah here in a little bit. Hanukkah began last Thursday night, December 10th, and runs through Friday. Christmas obviously is coming up. Nobody wants to be isolating or quarantining during a pandemic. Certainly you don't want to be sick, and certainly you don't want to be in a hospital. So this is a great opportunity for everybody just to slow down, especially right before the holidays. And then, of course, if you're going to go visit family, Test Nebraska is a great option to be able to go and see if you've got the virus. Some research I've read out there has said that 50% of transmission could occur from people who are asymptomatic or pre-symptomatic, which means you may have it and not know it, which means if you go to Test Nebraska, that might catch it. So before you go see family, go get tested. Great option. Test Nebraska is out there, testnebraska.com. We have had 585,000 Nebraskans sign up for Test Nebraska. We have delivered, let's see, how many tests have we delivered? 528,000 tests through Test Nebraska. So we've delivered a number of tests, and actually right now, we just got our turnaround time for the last 7 days to 24 hours. In fact, I went and got tested last night. I got my test result back this morning. So that is a turnaround time of about 17 hours, 17, 18 hours. So quick turnaround time right now at Test Nebraska. Please take that opportunity to go get tested. All right, so today we've got a number of things we want to cover. First of all, I talked about contact tracing, caught up on our backlog. We're actually back to normal operations with the types of questions we're asking right now. So the full slate of questions, that's a longer interview. So if you're getting called and the interview is going a little bit longer, that's one of the reasons. Going back 14 days, we do have now over 1,500 FTEs on a weekly basis that are doing those contact tracing. Also, wanted to make folks aware that we are calling up 17 members of our National Guard to be able to assist with our vaccine program. These are folks that are going to be helping us collect information from companies that would be in Phase 1B with regard to their priorities. So, Angie Ling is going to talk a little bit about the vaccine program here in a minute, but as we get into Phase 1B, we're going to be prioritizing in that phase, just like we've prioritized with healthcare workers. We're going to be talking to businesses. I'll give you an example. For a trucking company, we really want to focus on the truck drivers and the mechanics to keep the trucks rolling. So again, office staff wouldn't be in that category of prioritized to get the vaccine. So if you are a trucking company and somebody from the National Guard calls you and says, hey, we're just calling to see how many truck drivers and mechanics you have, please respond back. That helps us get an idea of how many people will be in those categories as we do our planning for Phase 1B. With regard to the vaccine, as I mentioned, Angie Ling is going to be here to talk about that in a moment. We did have, as of 9 a.m. this morning, 9 a.m., 1,746 Nebraskans have been vaccinated. Again, we are prioritizing those frontline healthcare workers. So by that I mean We're talking about critical care physicians and nurses, ER staff, people who handle infectious diseases. Those kind of folks are the people we're prioritizing right now. We do have a prioritized list for healthcare within Phase 1A, and those are the folks that are going first. Long-term care and residents and staff are also in that category for Phase 1A. So we've got a plan that will be taking care of them as well. Now, part of that plan is we have to have enough vaccines to be able to distribute out, to be able to do that. And so with the 15,600 we've received this week, we don't have enough to be able to start that program yet. But we will start that as soon as we have critical mass to be able to do that. And Angie can go into more detail about that if you, as well. The vaccine program, so far, again, we've had 13 hospitals give those vaccines. So the program is starting out there, and we're certainly encouraging all those frontline healthcare professionals to work with your hospitals to be able to get inoculated, and then also EMS as well. Those folks are also included in this category. So we're very excited that this program has started. We're looking forward to getting more vaccines in the future. Obviously, the Moderna product is going to be in front of the FDA tomorrow. If that gets approved, that could get us approved as early as Friday, and then we would have that for the Moderna allocation for next week. We have been told we are not going to get Pfizer allocation next week, so that will be pushed off to the last week of December. So with that, I'm going to call Angie Ling, who's our incident commander, to come up and go into a little bit more detail. She'll cover some of the same stuff I just talked about with regard to the vaccine, but she's going to go into more detail from our plan. So Angie, please come up.
Thank you, Governor. Good morning. As you've heard, we are very excited that the Pfizer vaccine product arrived in Nebraska on Monday, and by the end of today, we should have all 15,600 doses in the hands of hospitals who received the first allocations. As of 9 a.m. today, 13 hospitals have administered vaccine, and a total of 1,746 doses have been administered. We are anticipating the Moderna vaccine product to be reviewed by the FDA on Thursday, December 17th, and ACIP will meet on December 19th and 20th to make recommendations. And we are ready to accept those shipments as early next week. 32,400 doses of Moderna has been allocated to Nebraska for next week, and this will stretch to 112 hospitals, federally qualified health centers, and local health departments. As we have discussed previously, Phase 1A will include all healthcare and long-term care residents. Phase 1B will include first responders, education, correction staff, food and agriculture, transportations, and utilities. We continue to further define Phase 1B with our community partners and have the National Guard assisting with gathering information from entities who will be involved in these phases. It is important to note that the priority groups will be given the opportunity to get the vaccination first, but if they choose to wait, we will continue to move on. Facilities will not hold on to vaccine product for employees who have opted to wait to be vaccinated. We are hoping that with consistent allocations, vaccine will be available to all Nebraskans as early as spring. The U.S. vaccine safety system has a rigorous process to ensure safety. This vaccine has endured a significant amount of scrutiny during the clinical trials, in which more than 40,000 individuals participated. The Pfizer vaccine was 95% effective in the Phase 3 clinical trial. Comparatively, the flu vaccine is generally 40 to 60% effective. The COVID-19 vaccine does not contain a live virus and cannot give individuals COVID-19. The potential side effects from the vaccine are similar to those experienced by people who receive the flu shot. This would be soreness at the injection site, fever, headaches, body aches that usually go away within 24 hours. Unless symptoms worsen, there's no need to seek medical care. Pfizer reported no serious side effects from the vaccine, and there were no deaths directly linked to the vaccine itself. The FDA and CDC will continue to monitor the COVID-19 vaccine for safety, effectiveness, and any long-term or rare side effects. Also, the CDC has developed a new tool called vSafe. It's an additional layer of safety monitoring to increase our ability to rapidly detect any safety issues with COVID-19 vaccines. vSafe is a new smartphone-based after-vaccination health checker for people who receive COVID-19 vaccines. You can monitor your app stores on your phones for that availability. Many Nebraskans may have COVID-19 fatigue as this pandemic has spanned nearly a year. We hope these vaccines are a bright light at the end of a dark tunnel, but it's critical that we not give up before we cross the finish line. We must continue to be responsible and wear a mask and avoid the 3 C's: crowded places, close contacts, and confined spaces. Thank you.
Thank you very much, Angie. So just a couple of points then with regard to that. Angie talked about folks who may be prioritized and then decline to get the vaccine. I think it's a great point that, you know, hospitals never are going to move on, so you may not, if you decline and change your mind later, that vaccine may not be available later. So please take into consideration as you're being asked to be able to be in that program. And then again, I just want to highlight again, the National Guard is helping to collect that information from these companies to be able to make sure that we get a good allocation or a good idea of how many people are going to be in phase 1B. So as we're doing our planning, as we get more vaccines, and those companies are things. So again, if the National Guard calls you and said they're trying to get information, it's about the total number of people. We're not looking for names. We're just looking for how many truck drivers do you have, how many mechanics do you have, so that we can get an idea of how we're going to be able to allocate that going forward. So thank you very much, Angie. With regard to that, we're excited to have Moderna come before the FDA tomorrow, and hopefully that means that we'll be getting those additional allocations of Moderna next week and be able to expand the number of hospitals that are getting that. All right, next. So as I mentioned, last Thursday night began Hanukkah. Hanukkah is the Festival of Lights, and it's a season of hope. It's a season of increased holiness, as actually we had a little celebration yesterday with the rabbi, and that every day in Hanukkah you're supposed to increase your holiness. And it really fits in, I think, with regard to where we are right now. Angie was just talking about the vaccines, and the FDA met last Thursday, the night Hanukkah began, to be able to hear the data with regard to the vaccines, and now we've received the vaccines here in our state, and our first Nebraskans are getting vaccinated. So it is a season of hope, and Rabbi Katzman and all of our religious leaders in our synagogues, churches, and other places of worship have been working to take care of Nebraskans throughout this pandemic. Rabbi Katzman is the executive director of Chabad House, and you did Seders to Go during Passover, right? So being able to find ways to be able to serve their congregations and their communities still in light of the pandemic. And so, again, I'm grateful to all of our religious organizations who have worked with Lieutenant Governor to come up with those health protocols to be able to continue to serve the community while slowing the spread of the virus here. And Rabbi Mendel Katzman here is going to share with us some thoughts and reflections on Hanukkah and that hope and light. Rabbi?
Okay, so happy Hanukkah all. Just learning about the 3 C's. I figured another way of using the 3 C's is Hanukkah, and the other C would be acts of charity and contact. There's virtual ways, there are other ways how to create contact, and we must maintain contact with one another in ways like we have never before. So in the year 140 approximately BCE, the story of Hanukkah occurred. In case you want some details, we have it printed out for you, so we'll be able to pass them out. But the basic story is that there is, again, a tyrant who tries to pretend that there is no God and challenges those people, in this case the Jewish people, who are practicing, who are devoted, who are praying, who are connecting to the one above, and they're just not comfortable with it. And the evil streak within them encourages them and gives them, at least temporarily, the power to challenge those faithful. And of course, as you know, the end of the story, which turns out to be a very good ending, and the few overcome the many, and all the statistics and all the prognosis really fell flat on its face, and the godliness always prevails, but in an open way. So the point that I think it's important for us to apply that so many years later and realize that nothing changed. It's still the same. It might be a different plague, but it's the same order. And therefore, it's not by coincidence that the remedy and the vaccine comes right at the time of Hanukkah. It's not just by coincidence. I think it's also a divine lesson here. And the idea that taking it out to the street is really only on Hanukkah. The Seder, everything else we practice is inside or either our homes or our houses of worship. This is the only mitzvah, the only practice that we're required to take it as far as we can. And thank God, in this day and age, we're able to, and we're encouraged to do it as public as possible. And you know, so sort of other types of contact. And likewise, the prayer. The only time that we pray outside of Hanukkah outside is when there is a plague. In the olden days, we always had synagogues, but if there was a plague, there would be a public fast declared, and they would take it out into the streets and pray with the entire community. So needless to say that times like today, where we have been praying in so many different ways, virtually or otherwise, including everyone and realizing that we're one global village and we're definitely one big state, and rather than being influenced by election, other types of environments that create that divisiveness and we're this and therefore we're not that, but rather we're one nation under God, we're one people, and let us all pray together that all those that have been affected negatively or with some disease, especially the coronavirus, should be completely healed. And those of us that are healthy should remain healthy, and we should avoid any further suffering and discomfort. And we should together do whatever we can to use the 3 C's and to create more ways to connect with God, more ways to connect with ourselves, more ways to connect and be charitable to our neighbors, and this will we'll just be able to look back at this season or this year as a bad dream, and from here on we'll only celebrate together joy and happiness, light and goodness. Thank you.
Thank you, Rabbi. Happy Hanukkah. And thank you again. This is, again, a season of hope. And with the vaccine, we've got hope. We want to continue to express that message. We've still got work ahead of us with regard to slowing down the spread of the virus, which is why we continue to emphasize our messages about using our tools and avoiding the 3 C's. But there is hope. We just got to continue to work together. As the rabbi said, we are one big state, to work together to be able to defeat this virus as we've gotten through the other challenges we've had in the state in the past. So thank you very much, Rabbi. I appreciate you coming. And of course, we really appreciate all the religious leaders that have worked to be able to take care of their communities. Religious freedom here in Nebraska is something that is encouraged, celebrated, and protected in our Constitution, and we very much appreciate you being here today. Now, one of the other ways that we can help take care of our communities is by giving blood. We've had blood drives here at the state. We've had the Red Cross here as well. But with everything that's been going on through this pandemic, people have been staying home and blood donations have fallen off. And so we do need to remember that there are other people that are being impacted, not just by the coronavirus, but by other things where they do need that donation of blood, that life-giving substance. So here today to talk with us is a community volunteer from the American Red Cross, Wason Dunn, who is going to talk a little about giving blood and encouraging people that, hey, even with the pandemic, we still need to give blood so that we can take care of those folks in society who are going to need it. So, Wason, I'm going to turn it over to you.
Thank you, Governor Ricketts. Governor Ricketts, thank you also not only for the opportunity to be here today, but for all that you're doing to help lead our state through these challenging times. This season is traditionally very challenging in terms of maintaining our nation and our state's blood supply because of the holidays, winter weather, as well as the prevalence of colds, flu, and other seasonal illnesses in the community. That's why the American Red Cross is here today to ask Nebraskans to step up and do more and help us with blood donations and sponsoring blood drives so that we can make sure we maintain an adequate supply of blood for those that need it. You know, medical emergencies and medical conditions do not stop for the holidays, nor do they stop for a pandemic. A shortage of blood could potentially affect people who need emergency surgery. It can affect victims of accidents, automobile accidents, and other traumatic injury. And it can affect cancer patients who may need periodic blood transfusions. Every 2 to 3 seconds, somebody in our nation needs a blood transfusion. And it's important to remember that one single blood donation can help 3, potentially save 3 lives. So while the pandemic has not diminished the need for donated blood, it has unfortunately caused the cancellation of many blood drives. Here in Nebraska alone, since the beginning of the pandemic, we have seen the cancellation of more than 1,300 blood drives, leading to the projected loss of approximately 35,000 units of collected blood. So it's very important that we try to mitigate that problem. It's important also to note that blood drives and blood donation have been designated as essential services and part of our nation's critical infrastructure by the U.S. Department of Homeland Security. Additionally, the U.S. Surgeon General, the Center for Disease Control, the Department of Health and Human Services, and the Food and Drug Administration have all issued statements encouraging blood donation. Blood donation is safe even during a pandemic. Blood drives are conducted under the highest standards of safety and infection control. All donors and all staff are subject to health screening before they're allowed inside. Everybody wears a mask throughout the process. Social distancing is maintained, and we have a very aggressive and ongoing program of cleaning and disinfection at each collection station. In addition to helping our fellow citizens and human beings, there is an added benefit to donating blood to the American Red Cross. The Red Cross tests all blood donations for the presence of COVID-19 antibodies, which can potentially indicate whether the individual has been infected with COVID-19. So blood donors typically will find out within 1 to 2 weeks whether their blood has the presence of antibodies. They do this through the Red Cross Blood app or through the donor portal on redcrossblood.org. So if you are a blood donor or you are a blood drive sponsor, we encourage you to keep doing that. But if you've never donated blood or your organization has never sponsored a blood drive, now would be the time to consider doing so. A number of holiday blood drives have been scheduled for the next several weeks throughout the state of Nebraska. I have a list of those showing the specific dates, times, and locations, which I'll distribute to all the media outlets at the end of this press conference. But individuals who are interested in donating blood are encouraged to go to redcross.org and make an appointment to donate. Appointments are required because we need to maintain social distancing. And if your organization is interested in sponsoring a blood drive, please also go to redcrossblood.org and submit an application to be a blood drive sponsor. We're all in this together. We need Nebraskans to step up and help each other. And it's important also to remember that our hospitals and frontline healthcare workers have really been working hard and are struggling to continue to deal with the challenges of the pandemic. Helping the Red Cross maintain an adequate supply of donated blood will mean one less thing our healthcare workers have to worry about. So thank you very much, and Governor Ricketts, thank you again.
Thank you very much, Wason. I appreciate it, and thank you for all the Red Cross does to be able to help out in our communities, not only with blood drives, but all the things they do, such as the great help you all were during the flooding last year. So thank you for that. All right, so upcoming schedule. Again, a reminder, on Friday we've got the Nebraska State Patrol graduation ceremony at 10 a.m. So this press briefing will be in this room at 9 a.m. So we'll be doing it an hour early on Friday. And then next Monday we'll resume back with our regular time at 10 a.m. Again, back here in this hearing room. And then for the rest of the week, we will not be doing press conferences on Wednesday or Friday. Thursday and Friday are state holidays. So Christmas holiday will be Thursday and Friday. We will not do one on Wednesday. So it'll just be Monday next week. You only have one press conference to go to next week. All right, and with that, we'll get into questions and answers. Kellen Hevican from KLIN asks, What is the process for long-term care facility and staff residents to get vaccinated for COVID-19, and how and when will it begin? So the process is that, again, as I mentioned a little bit earlier, is you have to save up that critical mass of vaccines to begin the program. We've got about 50,000 people between staff and residents that we're going to be in this program, so we have to save up roughly that amount to get started on it. The federal government contracted with CVS, pharmacy, Walgreens, and then community pharmacies to be able to do that distribution to our long-term care facilities. Long-term care facilities signed up then with those pharmacies to be able to get them delivered. The vaccines will be delivered to those pharmacies, who will then go out to long-term care facilities and make those, do the vaccine program with them. There are some, I think it was 114 that didn't get into that program for whatever reason, maybe because they didn't have a pharmacy nearby. And those 114 will be taken care of through local public health departments. And so we'll be administering it that way. The ones that are going to the CVS and Walgreens will be the Pfizer ones. The ones going through the public health departments will be Moderna. Is that right, Angie? Okay, so I'm probably getting that correct. So that's the program of how that will be implemented. And the timing of that, again, would be roughly starting that last week in December. All right, Taylor, you had a couple other questions yet?
Don Walton says, coalition of mayors is urging rapid completion of the state's expressway system in consideration of highway construction bonds to get the job done. Do you have a comment on that?
So some mayors sent me a letter with, so Don Walton of the Journal-Star is asking, some mayors sent me a letter saying, hey, we need to speed up the process for building roads, and so we encourage you to do bonding. I oppose bonding. I will not support any bonding efforts in this legislative session. And the reason is because we at the state, our Constitution says we don't take on debt. So you'd have to actually change the state constitution, which I'm opposed to with regard to taking on debt. One of the reasons why we have a great financial position here at the state of Nebraska is because we don't take on debt. Typically, look, people don't take on debt for bad reasons. It's always for a good cause. But what happens is that over time, it gets out of hand, just like it can with your credit cards, and then you get in debt, and then you end up dedicating a lot of your budget to the interest payments. So we have avoided that here in Nebraska for over 150 years. We should continue to avoid that going forward. We should do pay-as-you-go. That's been our, look, Nebraskans are fiscally responsible. We should continue to be fiscally responsible, pay for as you go. We just, and with regard to completing roads, we passed the Transportation Innovation Act a couple of years ago, which is helping us accelerate the work on our expressways. That's the way we should approach it. Our Build Nebraska Act, the dedication of our sales tax, that's a way to budget for transportation. We should continue to do that.
Mark Balmer with KSND would like to know when Pfizer is going to send the next shipment of vaccine doses to Nebraska for the second booster shot that everyone will need.
Mark Balmer, KSNV, wants to know when is Pfizer going to be sending the next round of Pfizer vaccine, and then also when the second vaccine is coming? Is that two different questions?
Just basically when will the booster shots come?
When will the booster shots come? So the federal government is holding back the second round of booster shots that will take you up to that 95% effectiveness that Angie Ling was talking about. I think it was, one of the senior vice presidents at Pfizer said, William Gruber, Dr. William Gruber said that with the first shot, you can roughly get about a 52% effectiveness. The second shot will get you the 95% effectiveness. And so we expect that in January, the federal government would start releasing those second rounds of vaccines for the first round of people who got vaccinated here in December. Any additions to that, Angie?
It'll be
21 days after the first round gets administered.
Becca with NET says the ARP of Nebraska is warning that coronavirus spread in long-term care facilities has increased rapidly. What does the data show about recent trends in long-term care, and what more can be done to prevent new cases and deaths?
So Becca Costello with NET is asking, the AARP has released a statement saying that there's been a rapid spread in long-term care facilities, and what more can be done to be, what do the trends show? And that is accurate. We have seen an increase in the number of cases in our long-term care facilities and the accompanying deaths that go along with those increased cases. And what more can be done to help protect our long-term care facilities? We are taking a number of steps to be able to, for example, to accelerate the monoclonal antibodies to long-term care facilities. That's got its own challenges along with it. as well as some other steps. And Dr. Antone, can I ask you to come up and just say a few words about what we need to continue to do to protect our long-term care facilities?
So the data that we've seen as far as the increased number of cases and therefore deaths from long-term care facilities falls in line with what we've been seeing in the community. So as we saw our surge here over the last 2-3 weeks in the past, we saw the same type of surge in the long-term care facilities. So, you know, as the governor mentioned, we're one of the few states in the nation right now that are able to give these monoclonal antibodies to long-term care facility residents. And that can either be done in the facility itself, or they can go to an infusion center and get that. And that's through a program that Dr. Lawler and Dr. Ashraf has set up with the federal government. So we've had that advantage. We have another advantage here in Nebraska, and we've talked about this before. We have our infection control and prevention program, ICAP program, headed again by Dr. Ashraf and his team, very valuable to make sure that we control that spread, that we get the patients in long-term care into a red zone so it doesn't spread. And so far, that's been a major advantage. Those two issues have been a major advantage as far as our long-term care facilities go. So we saw that same surge in long-term care facilities. We've always said that long-term care facility resident spread mimics almost what we see in the community, and that's what we've seen over the last several weeks.
Thank you, Dr. Antone. And again, if I could just, I know that a lot of families, especially again with the holidays, are anxious to see their loved ones who are the residents in long-term care facilities and are frustrated when they can't see them personally. But again, we really want to emphasize we're really trying to make sure that we don't bring the virus into those facilities. And that's one of the reasons, for example, we take some of the steps to say you've got to follow this protocol before you can start allowing visitors in many long-term care facilities. You know, when they get a case, have to prevent visitors from coming in. So again, we just ask patience from the families who, especially this time of year, I know want to see their loved ones, but we're trying to make sure we're protecting our long-term care residents. And that's one of the reasons for that particular step to help slow it down.
Alyssa from KMTV says, when are inmates projected to receive the vaccine? Are they set to get them the same time as correction staff? And if not, why?
Alyssa from KMTV is asking when are inmates in our corrections facilities slated to get the vaccine. They would be in the category of the congregate living folks, and that's phase 1C. Is that correct? Yeah, phase 1C.
Bailey Bischoff with 1011 has a few questions. She would like to know when phase 1B will begin.
Bailey Bischoff of, I'm sorry, where's Bailey again? 1011 wants to know when will phase 1B begin. Again, it really is dependent upon what kind of shipments we get. So if we get enough shipments of vaccine to be able to take care of phase 1A, then we will start shifting into phase 1B. And I should just make note of this, that this will not necessarily be something that is uniform across the state. Different regional areas may get done with phase 1A earlier and move into phase 1B before other areas in the state. It just depends on how many vaccines we have and how fast people get vaccinated and so forth. I would expect, and Angie jump in here, that we'll probably be into at least starting phase 1B in January. Is that fair? That's accurate.
Bailey's next question is, she says there's still so much misinformation and skepticism surrounding the vaccine. Will the state do any kind of an education campaign similar to what's been done with coronavirus to encourage people to get the vaccine?
So Bailey said there's a lot of misinformation about getting the vaccine, and you know, is the state going to do a communication campaign around trying to educate people around that, just like we did around the other coronavirus issues, you know, like the 3 Cs? And the answer is absolutely yes. That's been part of the plan all along, to be able to phase into that vaccine communication as we get the vaccines more readily available for the general public. Again, as I've said, I would have no hesitation myself personally from taking it. As Angie said, you cannot get coronavirus from getting the vaccine. So we do want that information to get out there. We're also soliciting the help of our hospitals to be able to do communication out there. They've done a great job, even just this week, trying to show that people are getting the vaccines. Our healthcare professionals, our nurses, our doctors are getting it, and that it's safe and it's effective. So we will continue to get that message out there through forums like this, as well as the advertising campaign that we have going on right now from the state. And also, there's that community effort as well, and part of their plan is to transition into vaccine, talking about the vaccine as well. They've been, you know, if you're in, say, the Omaha area, you may have seen the advertisements in the World Herald for wearing a mask or on a bus or something like that. that campaign will also transition to talking about getting the vaccine.
Her last question is there a blood shortage at this time?
Wason, is there a blood shortage at this time? You want to come up and talk about that real quick?
At this current moment in time, here in Nebraska, we're actually somewhat holding our own. Nationally, there is a blood shortage. And the issue here is that blood donations typically are only good for about 40 to 42 days. And here in Nebraska alone, we go through hundreds of units a day for the 90 hospitals to which we supply blood. So there's a constant need. The need never abates. And that's why we're encouraging people to step up, because this time of year traditionally is when we see a dip in blood donations. And of course, the pandemic makes it even more problematic.
Thank you, Wason.
We have a question from Grant Schulte with AP. Republican legislators in Iowa may pursue a tax cut in their session this year despite the pandemic's impact on the budget. Are you looking at anything similar?
Grant Schulte with the AP says that Republican legislators in Iowa are going to be pursuing a tax cut in Iowa despite the pandemic and its impact on the budget. Are we going to be looking at something similar here in Nebraska? Obviously, we will be rolling out our legislative package later, so I'm not going to get into any details. But I will just point out that if you look at the state of our economy right now, I think we've got the lowest unemployment rate in the country at 3%. That's similar, actually, I think it's lower than where we were in February before the pandemic hit. If you look at our revenues, they've been exceeding our forecasts so far through this fiscal year. And we know that we've got to continue to work on things like property tax relief. So I think that, Grant, it's a fair expectation that you can expect some continued packages with regard to tax relief in the upcoming legislative session as we come back in January. All right, and that's all Taylor's got. Folks from here in the room, questions in the room. Martha.
How much of a concern is it that already the second week of the Pfizer vaccine is not going to be delivered? And do we know if we'll catch up at some point, or what happens?
Yeah, so Martha's asking, how much of a concern is it that the Pfizer vaccine is not going to be delivered next week? And will we catch up at some point? Well, it does mean for the month of October, or month of December rather, that we had originally expected to get about 104,000 doses of vaccine. Now we'll probably only get about 82,000. Again, we expect that you lay out a plan and that things are going to change. So we're going to be flexible with regard to that. If Pfizer continues to ramp up production, we should be able to catch up with this again and still hit that schedule where general public is getting this in April. So we're hopeful that Pfizer will be able to work this out, be able to start providing it. I think the other thing that helps us with this is that Moderna is coming online. There's also AstraZeneca and Johnson & Johnson that will, I'm going to say, likely go to the FDA in January to ask for approval of their vaccines, which means that you will see additional vaccines coming down the road. And I just want to, kind of highlight, because I was seeing there was some criticism of the administration about only buying 100 million doses from Pfizer. Why wouldn't you buy more? Well, it's because you want to buy them from other pharmaceutical companies because you don't know which ones are going to work, right? That's why you have multiple companies so that if one company isn't providing the dosages you thought they're going to provide, you can work on relying on the other ones as well. That's kind of the strategy the administration has taken here. So again, if Pfizer continues to have problems, hopefully Moderna and the other vaccine producers will be able to step up and make up for it. So we still expect at this point that general population will start being able to access those vaccines in April. Fred.
Did I understand correctly that prison employees are in phase 1B and that's expected in January, and then prisoners themselves are in phase 1C, and if so, when does that start?
So phase 1B is where the correction staff is that correct? And phase 1C is when the inmates are in. And phase 1B will start first. I can't give you a timeline for phase 1C right now because it really just gets back to how many doses of vaccine do we get, and then how many people are willing to take those vaccines, and the timeline to be able to get the logistics just about getting those people going. So I can give you the broad order, which is phase 1B is going to come before phase 1C. I can't tell you exactly a timeline. We expect that we'll get to phase 1B in January, but I can't tell you exactly when we'll get to phase 1C. Yeah, Andrew.
If you decline to take the shot right now, can you go to the bottom of the stack, or can hey, reapply and get it real quickly?
So Andrew's asking, say if you're a healthcare worker and you decline to get the vaccination right now, do you go to the bottom of the list, or will you be able to reapply later? Really, it's going to be subject to the availability and that hospital's policies. So there may be the opportunity, if you change your mind, to be able to get it, or there may not be, depending on the availability for that hospital. So just wanted to make people aware of that. If they decline originally, there's no guarantee they'll be able to get back in and get it right away. They may have to wait. Andrew, again.
Got a question, a little bit different subject.
A different subject? Okay, Andrew, that's fine.
Well, it's kind of related.
Oh, it's kind of related, okay.
Hypothetical. You've got a backlog in unemployment, claims. Can you tell me a little bit about that, how you guys are trying to address that, especially with the pupils?
So the question is with regard to backlog and claims and unemployment. And you know what, Andrew, I don't have that information off the top of my head, so we can follow up with you later on that one, or maybe get in touch with John Album, our labor commissioner. So Taylor, will you just take that as a note to follow up with Andrew? I don't know how big the backlog is and what John does a great job. He and his team do a fantastic job in the Department of Labor. Got to remind everybody, within 4 months at the beginning of this pandemic, we got as many applications as we got in 4 years, the previous 4 years combined. So they did a great job of processing those and stepping up and bringing additional people early on in the pandemic. But with regard to where he is currently right now, I just don't have the answer for that, but we'll follow up.
And also, you've got a deadline coming up here of December 26th, if Congress doesn't act. I mean, what do you tell some of those people that they have the first mistake, you're not going to be getting any more unemployment from insurance?
So the question was asked, well, there's a deadline of December 26th with regard to those extended benefits for unemployment. What do you tell folks? I would say, right now, actually, again, we've got a 3% unemployment rate. It's lower than what it was when the pandemic began. So I think there's opportunities out there. Now, some people may choose not to work just because of their health status or their family situation. Maybe they've got kids home from school, and so forth. So I certainly understand there's going to be different family situations along those lines. But we do have a current unemployment program out there. Those benefits in a normal time do expire after a certain amount of time. So we've got job coaches at the Department of Labor that can help you with creating a resume. There's opportunities out there to get additional education, help you get a better job, that sort of thing. We've got job coaches that can help you all through that. So if you are concerned about that, please contact the Department of Labor and set up an appointment to start talking with one of our job coaches about how we can help you get that next best job.
How can homeless people who often don't have transportation get tested, and if they don't have phones or computers, how can they get their results?
So the question was, how can somebody who is homeless, who doesn't maybe even have a phone or a computer, be able to get tested and so forth? And you know what? I think that they would fall into the same sort of category as folks who are disabled, where you've got providers that go to those communities, for example, the Visiting Nurse Association. We can double check that specifically with regard to those populations. For example, with the vaccine program, we are reaching out to the homeless shelters to be able to make sure they are, as part of the populations, being able to get their staff and residents vaccinated as well. And Angie, you got something on that? Yeah. You want to come up? You want to just come up and tell it? Thanks.
So for those homeless populations, within the shelters at least, we work very closely with them to, if they have testing needs, we get them the test kits that they need through Test Nebraska. So all they have to do is reach out to us and let us know that they need that. And if they need additional staffing to help collect those specimens, we can also assist with that. So we've worked very closely with the homeless population and shelters during this whole pandemic.
Thank you, Angie, because now that you mentioned it, I remember we actually had National Guard strike teams actually go to different homeless shelters to be able to do testing at those facilities. Yeah, Andrew.
And this issue will probably come up. I mean, when do you think the president should get tested, or the president-elect should get tested? I mean, and what went into your decision on when you think you should get tested, or not tested, get the vaccine?
Give the vaccine. I'm like, they should get tested as often as they want to get tested, Andrew.
When do you think the president of the United States or other leaders should
So the question was, when do I think that the President of the United States should get in line to be he was saying tested, vaccinated, thank you, Andrew, you got me doing it now, vaccinated and, and so forth. I would certainly defer to the President and the President-elect with regard to their decision about when to get vaccinated. What I've said is that I will be back in general population. I'm not a frontline healthcare worker. We need to preserve certainly those early vaccines for those frontline healthcare workers who are going to be taking care of coronavirus patients. And so, I've made the decision I will be back in the general population group. If you've got somebody who maybe is at higher risk, maybe that changes the equation. If you've got one of our leaders who's older, who's got underlying healthcare conditions, they would naturally be in a higher priority group, and then it may make more sense for them to get the vaccine earlier and get it prioritized.
But you don't think just being a leader in itself would jump the line and make you more of an essential?
Yeah, just in general, I think just being a leader in general doesn't necessarily mean that you should get jumped up to the front of the line, because it really gets back to what are we trying to accomplish? Well, we're trying to make sure initially we're taking care of the people who have coronavirus, that we're making sure our hospital staff, our long-term care staff, our long-term care residents are at risk. So those are the folks that we're really prioritizing. And then as we move into phase 1B, it's going to be kind of those infrastructure type professions like we talked about with truck drivers or food production that we really want to make sure, again, essential to keeping things going. So that's really where our focus, certainly for our plan here in the state of Nebraska, is. Other leaders may make other decisions about it, but generally that's how we're thinking about it here. It's about keeping those critical functions moving forward. Other questions? All right, seeing none. Thank you again, folks. Again, I want to remind everybody it's important that we continue to practice all the good tools that we've been learning about slowing the spread of the virus. Staying home when you're sick, that's a critical one right there. Stay home when you're sick so you don't spread the virus. But also, we want to make sure that people are keeping that 6 foot of distance between themselves and others in public, wear a mask when you go to the store, wash your hands often, work from home if you can, that's a good one. Shop once a week by yourself. Avoid the 3 C's. These are all things that we can do to help slow down the spread of the virus. And again, slowing down right now is a good idea because we got the holidays coming up. Nobody wants to be isolating or quarantining, and certainly nobody wants to be sick or in the hospital over Christmas. So please, everybody, now's a good time to be able to make sure we're following all of our rules with regard to slowing the spread of the pandemic. And of course, with the vaccines coming and that ramping up here over the next several months, we've just got a few more months to go through to be able to get through this. There is hope out there. There is light at that end of the tunnel. So let's just keep all working together to be able to slow the spread of the virus and preserve our hospital capacity. Thank you all very much. And again, we'll be here again 9 a.m. on Friday for our next press briefing. Everybody have a good one. Thank you, Francis. Thank you, Rabbi. Happy Hanukkah. Thank you, Wason.